Chapter 10 on the endocrine system. Disorders of the endocrine system are usually evaluated by ultrasound, CT, MRI, nuclear medicine, and PET. To look at a couple of examples of pathologic conditions specific to the system, enlargement of the adrenal glands is best demonstrated by CT, and thyroid tissue is best demonstrated by the use of nuclear medicine. The endocrine system has glands that secrete hormones. These hormones are chemical messengers that circulate in the blood and may affect a single target organ or the entire body. The major endocrine glands are the pituitary, adrenal, thyroid, and parathyroid glands. Hyperactive and hypoactive production of hormones from these glands give rise to a wide variety of clinical symptoms and radiographic abnormalities. There's what's referred to as a control mechanism within the endocrine system, and that's the production of two hormones whose actions are opposite to each other. For example, insulin is secreted by the pancreas when the blood glucose level rises. When the blood glucose level falls below normal, the second hormone, glucagon, is secreted by the pancreas to raise the blood glucose level. Thus, these two hormones are balanced so that a proper blood glucose level is continually maintained. The adrenal glands are otherwise called suprarenal glands, and they look like little hats on top of the kidneys. They consist of an outer cortex and an inner medulla, and we'll find that each of those areas will secrete different types of hormones. The adrenal cortex secretes 3 hormones, while the adrenal medulla secretes 2, specifically epinephrine and norepinephrine. I'm sure you recognize those as the fight or flight hormones secreted in stress situations when energy and strength are needed. By constricting some vessels and dilating others, the epinephrine shunts blood to active muscles where oxygen and nutrients are urgently needed. Cushing's syndrome refers to the excess production of the glucocorticoid hormones that may be attributable to generalized bilateral hyperplasia of the adrenal cortex, or it may be a result of a functioning adrenal or even non-adrenal tumor. An example of a non-adrenal tumor would be a pituitary adenoma. It could also be the result of an exogenous administration of cortisone. The physical appearance in humans is obesity, moon-shaped face, and a fat pad behind the shoulders. Imaging appearance may be generalized enlargement of the adrenal glands. In the skeletal system, it can result in diffuse osteoporosis that causes generalized skeletal demineralization that can lead to the collapse of vertebral bodies, spontaneous fractures, and aseptic necrosis at the head of the femur or humerus. This is considered a destructive condition due to the extensive osteoporosis. In this image, we see a nephrotomogram that demonstrates a huge suprarenal mass causing indentation and downward displacement of the left kidney. There's a 4 centimeter mass in the left adrenal gland that can be seen posterior to the tail of the pancreas and anterior to the kidney. Note the difference in size of the left adrenal gland compared to that of the right one. Hypoadrenalism is also referred to as adrenal insufficiency. Chronic symptoms include fatigue, weakness, weight loss, and increased melanin pigmentation. Acute symptoms, on the other hand, include hypotension, rapid pulse or tachycardia, vomiting, and diarrhea. The most common cause of adrenal insufficiency is the excess administration of steroids. In this image, you can see bilateral adrenal enlargement in the CT scan that was caused by histoplasmosis. Adrenal carcinoma tumors grow rapidly and are usually large necrotic masses at the time of clinical presentation. Ultrasound demonstrates a tumor is a complex mass that may be difficult to separate from an upper pole renal tumor. A CT scan performed 1 month later shows diffused and homogeneous enhancement with the appearance of some low-density areas suggesting necrosis. In this image, we can see a large soft tissue tumor that invades the anteromedial aspect of the left kidney. The axial MRI image demonstrates a large left adrenal tumor invading the left renal vein and the inferior vena cava. In a different patient, we can see the coronal MR image that demonstrates an adrenal mass with a tumor thrombus of slightly higher signal intensity filling the inferior vena cava. The adrenal gland is one of the most common sites of metastatic disease. The primary tumors that frequently metastasize to the adrenal gland are carcinomas of the lung, breast, kidney, ovary, GI tract, and melanomas. Metastatic enlargement of the adrenal gland can cause downward displacement of the kidney with flattening of the upper pole. Taking a look at the CT axial scan, we can see the huge irregular low attenuation mass representing adrenal metastases from Oat cell carcinoma of the lung. Neuroblastoma is a tumor of adrenal medullary origin and is the second most common malignancy in children. Approximately 10% of these tumors arise outside of the adrenal gland, primarily in the sympathetic ganglia in the neck, chest, abdomen, or pelvis. The tumor is highly malignant and tends to attain great size before its detection. Calcification is common in neuroblastoma, occurring in approximately 50% of cases. In the AP projection of the upper abdomen, we can see a diffuse granular calcification within a large primary tumor. In the lateral projection of the skull, we can see a calcified deposits within a metastatic lesion in the calvaria. Intravenous urography usually demonstrates downward and lateral renal displacement by the tumor mass, as we can see in this nephrotomogram. Additionally, neuroblastoma can appear as a bilateral widening of the paravertebral stripes representing metastatic deposits. Metastases to the bone, liver, and lungs are common in neuroblastoma. Metastases to the skull typically cause spreading of cranial sutures because plaques of tumor tissue growing along the surface of the brain. And we can see in this nuclear medicine bone scan performed in a 1-year-old boy with a left adrenal neuroblastoma was performed to evaluate for osseous involvement. The temporal bones in orbital zygomatic region demonstrates increased uptake, appearing as raccoon eyes. The pituitary gland is often called the master gland because the many hormones it secretes control the level of most glandular activity throughout the body. The pituitary is a tiny gland about the size of a pea that's suspended from the base of the brain and sits in the bony depression of the sella. The hormone secretion of the pituitary gland itself is controlled by the hypothalamus. The pituitary gland is divided into anterior and posterior portions, each of which secretes different hormones. In this diagram, we can see where the anterior portion of the pituitary gland stimulates 5 different hormones, while the posterior portion stimulates production of 2. Hyperpituitarism results from an excess of growth hormone produced by a tumor or generalized hyperplasia of the anterior lobe of the pituitary gland. Gigantism refers to development of the condition before endochondral growth has ceased. Acromegaly refers to hyperpituitarism beginning after bone growth has stopped. Generalized overgrowth of the body tissues is the underlying abnormality in acromegaly. The long bones can no longer grow because epiphyses are closed. However, the bones of the hands, feet, and face enlarge, and there's excess growth of the soft tissues. Thickening of the heel pads to more than 23 centimeters is highly suggestive of acromegaly. Since this patient's heel pad measures 32 millimeters, it is highly suggestive of acromegaly. The bones of the skull become thickened and have increased density. The bone thickening is especially prominent in the frontal and occipital regions, leading to the characteristic frontal bossing and enlargement of the occipital protuberance. The paranasal sinuses, especially the frontal, also become enlarged. Other imaging appearances include the pituitary enlargement that causes expansion and erosion of the sella turcica. It's also referred to as ballooning of the sella. Hypertrophy of the soft tissues may produce an increased concavity of the posterior aspect of the vertebral body, referred to as scalloping, and this is prominent in the lumbar spine. Decreased function of the pituitary gland causes profound generalized disturbances in bone growth and maturation. The result in children is a type of dwarfism, in which the delayed appearance of epiphyseal centers causes the failure of the bones to grow normally in length or width. Hypopituitarism occurring after adolescence results in hypofunction of the thyroid gland, adrenal glands, and gonads. Diabetes insipidus refers to the impaired ability of the kidneys to conserve water that results from the low levels of ADH, reflecting deficient vasopressin release by the posterior lobe of the pituitary gland in response to normal physiologic stimuli. In response to a person having polyuria, they're going to have an insatiable thirst, otherwise referred to as polydipsia. Something to mention is that this condition is completely unrelated to diabetes mellitus. The thyroid is a butterfly-shaped gland located in the neck at the level of the larynx. It consists of two lobes, each on either side of the trachea, and a connecting strip that runs anterior to the trachea and connects the lower portions of the two lobes. The thyroid gland picks up iodine from the bloodstream and combines it with amino acids to synthesize thyroid hormones, which are stored in the gland until released into the bloodstream when stimulated by the TSH from the anterior lobe of the pituitary gland. Nuclear medicine is the superior imaging modality for demonstrating functioning and non-functioning thyroid tissue. This is a normal radioactive iodine scan in which there's uniform distribution of the nuclide activity throughout the thyroid gland. Masses within the thyroid gland may appear as hyperfunctioning or hot nodules. The hot nodule demonstrates greater radionuclide uptake than surrounding thyroid tissue. Hot nodules are rarely malignant. Masses within the thyroid gland may also appear as hypofunctioning or cold nodules. Cold thyroid nodules contain less radionuclide per unit tissue mass than adjacent normal thyroid tissue. Most cold nodules represent poorly functioning adenomas. Thyroid cysts, carcinoma, and thyroiditis can also produce this appearance. Hyperthyroidism refers to the excessive production of a thyroid hormone. The origin can be the entire thyroid gland, which in that case would be Graves' disease, or from one or more functioning adenomas, which would be referred to as hotspots. Graves' disease refers to hyperthyroidism of the entire gland. The clinical symptoms include nervousness, emotional lability, an inability to sleep, tremors, tachycardia, palpitations, excessive sweating, and heat intolerance. Weight loss is common despite an increased appetite. The characteristic physical finding is exophthalmos, which is outward protrusion of the eyeball caused by edema in the tissues behind the eye. The appearance on nuclear medicine scan is a diffuse enlargement in the thyroid gland with increased radioiodine uptake. In these two scans of two patients with Graves' disease, you can see symmetrically enlarged thyroid glands with homogeneously increased iodine uptake. Hypothyroidism results from any structural or functional abnormality that leads to an insufficient synthesis of the thyroid hormone. Hypothyroidism in children results in what's referred to as cretinism, and that's dating from birth. In adults, it's going to have different types of symptoms and can result in problems with the heart. So we'll talk about that in just a moment. Hypothyroidism dating from birth is referred to as cretinism. Children with cretinism typically have a short stature, coarse features with a protruding tongue, broad, flattened nose, widely set eyes, sparse hair, dry skin, and a protuberant abdomen with an umbilical hernia. The major radiographic abnormalities in children include a delay in the appearance and subsequent growth of ossification centers and retarded bone age. Skull changes are common and include an increase in the thickness of the cranial vault, under aeration of the sinuses and mastoid air cells, widened sutures with a delayed closure, and a delay in the development and eruption of the teeth. Hypothyroidism in adults has an insidious onset with nonspecific symptoms including lethargy, sleeping up to 16 hours a day, constipation, cold intolerance, slowing of intellectual and motor activity, and weight gain despite a decreased appetite. Radiographically, the heart in adults is typically enlarged because of the pericardial effusion. Soft tissue thickening. A goiter is an enlargement of the thyroid gland that does not result from an inflammatory or neoplastic process. The cause is when one or more factors impair the capacity of the thyroid gland in the basal state to secrete the quantities of active hormones necessary to meet the needs of the body. The appearance is an enlarged thyroid gland impressing on or displacing the trachea and the esophagus. Imaging appearance in nuclear medicine is a multinodular goiter. The radioactive iodine scan demonstrates patchy uptake of the radionuclide caused by increased and decreased uptake by the thyroid. Ultrasound is indicated to determine whether a non-functioning mass detected on a radioactive iodine scan is cystic or solid. It may also be used to monitor growth of thyroid nodules. In the image shown here, we can see that there's a solid mass that was measured to be 8 by 15 millimeters in both lobes of the thyroid. The Doppler image demonstrates increased vascularity. Benign thyroid adenomas are encapsulated tumors that vary greatly in size and usually compress adjacent tissues. The imaging appearance is calcification may develop within the mass of a thyroid adenoma. And note the huge calcified thyroid mass in this image. Thyroid carcinoma refers to cancer of the thyroid gland. On radioactive iodine scans in nuclear medicine, a thyroid carcinoma usually appears as a solitary cold nodule that corresponds to a palpable mass. In these ultrasound images, we can see that there's a lesion that's not smooth. Note the papillary projections, and it lacks a back wall enhancement. These features most often indicate a degenerative follicular adenoma. The parathyroid glands are 4 tiny glands, 2 on each side, that lie behind the upper and lower poles of the thyroid gland. They secrete parathormone, which is the parathyroid hormone, PTH, and this is responsible for regulating the blood levels of calcium and phosphate. Hyperparathyroidism refers to excessive secretion of the parathormone that leads to a generalized disorder of calcium, phosphate, and bone metabolism that results in elevated serum levels of calcium and phosphate. There are 3 types of hyperparathyroidism. The primary form may be caused by a discrete adenoma or carcinoma, or by generalized hyperplasia of all glands. Secondary hyperparathyroidism occurs more frequently than the primary form. It is most often attributable to chronic renal failure. The tertiary form refers to the development of autonomous functioning parathyroid glands. The earliest radiographic changes are subperiosteal bone resorption, which particularly involves the radial margins of the middle phalanges, the distal clavicle, and the medial aspect of the upper third of the tibias. Imaging appearances can include the brown tumors, which are multiple lytic lesions, and also the salt and pepper skull. Other radiographic appearances include osteosclerosis, which could be in the superior and inferior margins of the vertebral bodies, and also tumoral calcification. Hypoparathyroidism is a result of insufficient secretion of the parathormone. It causes sustained muscular contraction, muscle cramps in the hands and feet, and numbness and tingling of the extremities. The cause may be injury or accidental removal of the parathyroid hormones during a thyroidectomy. The imaging appearance is cerebral calcification, and that can be visualized in both skull radiography or in a CT of the head. The pancreas is responsible for the release of insulin and glucagon. Diabetes mellitus is a common endocrine disorder in which either beta cells in the islets of Langerhans of the pancreas fail to secrete insulin, or target cells throughout the body fail to respond to this hormone. The result is hyperglycemia. Common manifestations include polyuria, which stands for excessive urination, and polydipsia, which refers to drinking large quantities of liquids. The major sign is glycosuria. Because glucose cannot enter the cells without the action of insulin, diabetic patients are forced to metabolize a large amount of fat. This produces a large number of acids and ketones, which can be detected in the urine. Severe acidosis and dehydration in a diabetic patient who fails to take enough insulin or eats a high-sugar diet can lead to a diabetic coma, which may be fatal if not rapidly treated with fluids and a large dose of insulin. The major complication of diabetes mellitus is atherosclerosis. It causes arterial narrowing and even occlusion, resulting in myocardial infarction, strokes, or gangrene. The diabetic patient frequently develops infections, which tend to heal poorly because of generalized poor circulation in the patient. The kidneys are always affected by long-standing diabetes, and kidney failure is frequently the cause of death. Another complication is narrowing and rupture of the minute retinal blood vessels, which may lead to blindness. It's important to differentiate between a diabetic coma and insulin shock. A diabetic coma results from excess sugar, otherwise termed hyperglycemia. It leads to the point where the person goes into a coma, and this can be fatal if not treated rapidly with fluids and a large dose of insulin. Insulin shock is also called hypoglycemic shock. It results from too much insulin or not enough food. The person feels lightheaded and faint, trembles, and begins to perspire. It is important to monitor diabetic patients in radiology for signs of developing insulin shock. In the image shown here is typical calcification in moderate-sized vessels of the hand and wrist in a patient with diabetes mellitus. Men with diabetes may demonstrate characteristic bilateral calcification of the vas deferens. Diabetic patients have an increased susceptibility to infection, which especially affects the feet and may lead to severe osteomyelitis, producing bone destruction without periosteal reaction. This can result in diabetic neuropathy. And we can see this neuropathic joint in a patient with diabetes mellitus, in which there are destructive changes with calcific debris that can be observed about the intertarsal joints. Note the characteristic vascular calcification posterior to the ankle joint. Vascular disease with diminished blood supply can lead to gas gangrene, in which bubbles or streaks of gas develop in the subcutaneous or deeper tissues. Mucormycosis infection is a devastating fungal disease that occurs virtually only in persons with uncontrolled diabetes. It usually originates in the nose and perinosal sinuses. Pulmonary mucormycosis is a progressive severe pneumonia that is widespread and often cavitates. Notice in this image that we see a large, thin-walled cavity that contains a smooth elliptical homogeneous mass representing the fungus ball. That concludes our lesson on the endocrine system. I hope you have a great day.